Hi, everyone. I'm Dr. Katie Snow.
And I'm Dr. Eric Snow. We are so excited that you decided to be a part of the Gut Reset program. So we're about to dig into the science behind the gut reset. So why learn the science? Well, number one, healing the gut and improving your health is a journey, not a destination. So what does that mean? What we teach in our practice is that the secret to health and vitality is really in your lifestyle. It's your daily habits. It's what you do over and over and over again. And so it just doesn't end. It's like a good workout program. You're lifting weights, you're eating the right foods, and you're getting the results. You feel better. You're putting on muscle. You're burning body fat. You do it for 2 to 3 months and then you stop. You go back to your old habits. And what happens? You start losing the muscle. You start putting the body fat back on. And so it's really a journey. It's not something that you stop. We have to put these habits in, learn the science, be convinced why we should do this, and keep it up. And we get to enjoy a long life of health and vitality. Number two, studies show that if you understand the rationale, you're more compliant. And we see that a better educated consumer, a better educated patient, they understand where you're leading them. And so you have agreement. They believe now that this works. This is real, true information. And so you're going to have a more successful outcome. You're going to have more endurance to stick it out as well. And then number three, understanding the science makes it easier for you to get your support system, including your family, healthcare provider, to support you. When we all know where we're going, we can all go to the same place and we have that agreement, and that makes us successful. And so part one, we're going to talk about what is the mucosal barrier and what does it mean to actually have a leaky gut. So your mucosal barrier, when you really look at this, the body is really a hollow tube. Because if you think about it, when you put food in your mouth, it's really still like external if you think of the body as a tube. And that tube runs from your mouth all the way down through your chest. The stomach opens up and then it turns an intestinal tract. And then it goes out through the back end there. But that's really a tube. And so your sinuses, all these internal areas, they're lined with mucosal membranes. And that gives us a barrier to actually protect from infection, invaders, and allergens. And this mucosal barrier is really key to having a healthy gut because it's your first line of defense. And so intestinal permeability, if you're looking at the graphic, you'll see a normal gut graphic there. You see the pathogens and the food particles. That's actually inside the intestine there. And then you see the tight junctions there, the very specialized mucosal cells. They're very tightly knit. And then when you look at the leaky gut picture, we can actually see where those junctions have basically loosened up. And now, whatever it is, the pathogens or the food particles, they can actually slip through that leak or that crack in the gut. And now they get introduced to the bloodstream and they're not supposed to be there. And so that's where we get this immune response. And then that sets the cascade for food sensitivities, infections, systemic inflammation, which is actually being linked to so many of the diseases of modern day today.
Yeah, a lot of the autoimmune diseases, and the list just gets longer and longer as people, these autoimmune diseases, we're seeing them more and more with our patients. They come in and, every day there's a newly named autoimmune disease. So a lot of this is tied right back here to what he was talking about with, us, the junk food that we're consuming in our diet that's really creating this problem in our gut. So.
Yeah, and it's real interesting when you're taking a functional nutrition approach to health and disease. I've just been amazed at how many cases where you might think, hey, this is a hormone case, or this is even a musculoskeletal case. And once we start clearing some of the superficial inflammation out of the way or problems, we see, hey, this is actually going back to the gut. And even heart cases where it's like, where do we start? We don't even have a name for the symptom patterns. And so we look at the symptoms, we see, hey, there is indicators for leaky gut. We go there, and so many even mysterious problems have been healed from taking this leaky gut approach and understanding the science behind it. And so This slide here, we're talking about metabolic endotoxemia or junk food disease. It's a silent killer. So having some bacteria toxins leaked into the blood leads to chronic low-grade inflammation state, but we're seeing that this can actually be the cause of all modern chronic diseases, which is
Mhm.
very interesting statement to make and an interesting thought to think about. But we see increase in inflammatory visceral fat. So that's fat around your organs, between your organs. That's where we're talking about fatty liver. We see an increase in bad cholesterol or LDL because LDL is so important for removing these toxins from the blood. So
Mhm.
body's having to produce more of that. And then we have insulin resistance. 90% of Americans are actually insulin resistant. So we're seeing this is coming back to the foods. It's a lifestyle generated disease, and it leads to metabolic syndrome and diabetes. And then we're seeing neuroinflammation, which is the main cause of brain fog,
Mhm.
depression, and eventually dementia. And so this is the whole brain on fire concept here.
Mhm.
So factors that open up the gut barrier. So the most basic is the standard American diet, which is an unhealthy diet, has bad fats in it. So mostly when we talk about bad fats, we're talking about man-made fats, not specifically saturated fats. Everything needs to be in moderation. And of course, sugar. Sugar is such an instigator. It's so inflaming. It's
Mhm.
anti-nutrient, and sugar happens to actually feed pathogenic microbes in the gut. And
Mhm.
then we see diets low in fiber as well. And so that's a really big factor and open up the gut barrier. Gut irritants in food, and that is a really big spectrum from glutens and lectins,
Food
and then yeah,
dyes.
food dyes, food additives, food chemicals. There's even, believe it or not, if you read the ingredients list at some of our fast food restaurants, they actually have antifungals in the food, and antibiotics in the food at really low
Mhm.
levels. And so when you eat that over and over again, it actually harms your good bacteria. Just even stress is going to affect the gut as well. Sleep deprivation is a big one.
Mhm.
So many cases when we get the person to sleep, especially your hormone case, the body's actually able to repair properly. And so sleep deprivation is huge. Dysbiosis. Dysbiosis means disruption of the biology of the gut. And that happens for many of these things that we're talking about. But the good bacteria gets disrupted, real common in antibiotic therapy. And then the problem is the standard American diet, or most people's diets, do not have the prebiotics. They don't have probiotics in them because the food are so processed. And so that good bacteria never gets built back up again because
Mhm.
we don't get re-inoculated through fermented foods or raw foods, and we can't feed the good bacteria because our foods are so processed.
And then the lack of fiber, it's like a garden. You have to lay the foundation and have the mulching in the garden to provide that environment. And so, the standard American diet is void of so much of the good fiber, like we were just talking about. And so that also adds to the dysbiosis.
Yeah, and these fibers, as Dr. Katie's saying, they actually feed the good bacteria.
Hmm.
So we need a diversification of these fibers. And
Hmm.
then gut infections. I've seen so many people end up with very severe leaky gut and even go into autoimmune progression through having these gut infections. A lot of times it could just simply be from a food poisoning, could even be from parasites from our food. We see that a lot when people travel
Hmm.
abroad. When people travel abroad, we check them when they come back, but we actually, if they let us, we send them with different enzymes and even maybe things with protease and betaine to help minimize those infections in these foods. But gut infections can really wreak havoc on the gut and open that gut barrier. And then, of course, we already mentioned antibiotics, but medications, stomach acid reducing medications really throw the pH off, cause a lot of nutritional deficiencies, set you up for even more infections because that stomach acid is really a part of your immune system. We need good, strong stomach acid. So when we eat the food, we can actually kill the bacteria in there, parasites in there. Steroids, NSAIDs, anti-inflammatory drugs, even birth control pills can be an irritant to open up the leaky gut. And then digestive disorders, especially like celiac disease, inflammatory bowel disease, because it's that chronic inflammation that's going to open up the gut, allow those different agents like food particles and even germs into the bloodstream, and that creates a big immune cascade.
Hmm.
And then major injuries, surgeries. I had a surgery about 2 years ago, and so they had to use antibiotics with that. And it was in the abdominal area, but it took me about 6 months to really get my gut back in check. I noticed a very big disruption in my gut ecology,
Hmm.
and even mild traumatic brain injuries can actually cause issues with leaky gut. And then we have alcohol, food additives, and things with like surfactants that are soap-like can really irritate the gut as well.
Yeah, makes sense.
And so your gut bacteria has very critical roles. So digestion, producing enzymes, gut barrier health, probiotics actually fuel and strengthen the gut barrier.
Hmm.
Having a very diverse and strong population of probiotics is one of your number one immune defenses. They're like soldiers down there
Hmm.
policing the gut ecology. Chemical conversion of hormones, these bugs do with drugs and chemicals, vitamins, neurotransmitters. So their actual metabolism helps to produce so many things for us. And then skin health. So many patients, when I see a skin problem, I'm thinking, hey, we need to go to the gut first. So many skin problems are caused from leaky gut, food allergies, food sensitivities, candida overgrowth, and then metabolism through minimizing metabolic endotoxemia and extracting calories from food. And so gut bacteria does a number of things for us. So it's very critical that we have a good, healthy gut.
Yeah, and one thing that's not on this list is think of your gut bacteria as little reservoirs of nutrients that in certain cases when your body needs those nutrients, they're there holding different nutrients that your body may need in a holding tank. And so sometimes there's a little more demand on the body, and so you'll actually be able to pull from your good bacteria to get those different nutrients that your body may need. So during a time of stress. So it's interesting how God created our body and all these things are put into place, even though sometimes we don't take care of our body in the best way that we should. But He put so many things into our bodies to, to still have that health, be there, even though there's times of stress, maybe something that we can't avoid. But then there's times where people just don't eat, that correct diet. So it's just so amazing how our bodies are made.
Yeah, the body's so amazing. And, I still remembering starting practice in 2005, preaching probiotics, preaching food sensitivities, getting results with patients that already had GI doctors, and these doctors getting frustrated with me, telling people that information is not good information. And so here we come just now to 2021, and almost every doctor now is probiotic, and so it's
Hmm.
cool to really see the change. We have so much knowledge now, and that's what we're
Hmm.
sharing with you today is the current science on this, and you just have to know it if you want to be healthy. And
Yeah.
so, how do you know if you have a leaky gut? Very, very important question to ask. And so we now have lab tests. We can do things with lactulose and mannitol tests. And then symptoms is what we really go by. You get to where you just know that they have leaky gut, and we're all for testing, not guessing. But not everybody has the money to actually pay for these really good functional medicine tests. And so you can actually just go through a symptom checklist and see like, hey, that's what I got. But stubborn weight gain is a really telltale sign. Fatigue, even getting proper sleep, you're still like waking up tired. That really has to do with the chronic inflammatory burden that you are under when you have the leaky gut. Because now every time you eat something, you're creating inflammation, inability to keep healthy weight on, high cholesterol, triglycerides, and blood pressure. Who would have thought that has everything to do with leaky gut?
Hmm.
Um, Nutrient deficiencies, not fixed by proper supplementation over months. And so what we mean by that is you're on a good, solid nutrition program, supplement program. We're not seeing the benefits. We need to rule out that you have a leaky gut. And inflammatory symptoms of hormone imbalances, hot flashes can be tied back to leaky gut. And again, that comes back to inflammatory burden. And basically what happens is when you're inflamed, your body takes hormones, instead of converting them into testosterone or progesterone, they get put into the inflammatory picture. And so the body steals that and uses it for inflammation. And so you don't have the hormones you need to have a libido, to wake up in the morning, to feel good, to have stamina. So this can be tied back to leaky gut. Inability to focus, memory problems, brain fog. It affects the brain, vision and hearing issues, moodiness, mood swings, irritability, depression. Two things I always consider with irritability is sugar handling problems and leaky gut. We have seen so many times when the gut is inflamed, people have chronic anxiety. So when you have that chronic anxiety, it just does not go away, or irritability, then I'm thinking leaky gut. If it tends to come and go, we look more towards sugar, but we're seeing now sugar handling can be tied with a leaky gut. Insomnia, sleep problems, digestive issues, bloating, gas, indigestion, diarrhea, constipation. That about names almost everything that somebody comes into the office with. And so when you have multiple of these symptoms, you can definitely have a leaky gut.
Yeah, I know there's another test, the zonulin test, that a lot of people are doing as well. But again, we can pretty much, with our clinical experience working with patients, a patient walks in, we do a very thorough, run through of their symptoms, what major life stressors they've had. Because a lot of times we'll see just a decline in health right after, a death in the family, divorce, people, like we went through a double hurricane in our community a year ago, and it was just devastating for so many people to experience that. And then we went through COVID, and there was, family members and friends that passed away. And so when you get shaken with a major, life stressor, and we see that, and then we just kind of start pulling the string and looking at, where did all these symptoms come from all of a sudden? It's not rocket science to figure out, major amounts of cortisol that get pumped out, and that just tears up the gut lining. So again, we'd rather just dive right in and start working on fixing that gut than to keep going, oh, well, it's this amount of this and this test. And we've just seen it time and time again with our clinical experience. So it's pretty straightforward. And we just want to get in there and start fixing that so that person can get back to a normal life and, live their best life and have the health that they deserve.
Yeah, and it's interesting what you said, Dr. Katie. How many times when you're doing a history on a patient and you ask, well, what happened before that? What happened before you got sick? What happened a year before you got sick? And we see, okay, it was that stress event. It could be weather, it could be loss of job, it could be, death of a family member, just any type of stress, or divorce even. And the body gets stuck in that sympathetic state, overloaded with cortisol, breaks down the body, including the gut. And we see that cascade, of autoimmune disease, fibromyalgia, chronic fatigue, hormone problems. So it's very important to understand the mechanisms of this. But leaky gut symptoms, there are so many of them, but skin problems definitely is something to really, really consider. That you have leaky gut syndrome and even possible food sensitivities, chronic bad breath, urinary tract infections. I see that a lot. There's a real strong tie to urinary tract, colon health, and even the vaginal flora when it comes to urinary tract infections. So we need to go back into the gut. We've seen so many infections just improve, even when it wasn't responsive to antibiotics. Put in a good dose of probiotics in there, and we'll see that UTI clear up. But definitely vaginal infections. Not all, but in my experience, almost all vaginal infections are tied back to gut dysbiosis. And you see that after a patient, especially female patient, they take that antibiotic and they get a yeast infection. Even see that with men, they get a prostate infection and a lot of that is a fungal in origin. But headaches, chronic pain, autoimmune diseases. If you have an autoimmune disease, you need to understand leaky gut syndrome, period.
Hmm.
Because our approach has been a leaky gut approach for all our autoimmune disease cases. People have multiple problems on top of that. But when you get the foods cleaned out, you find out what they've developed sensitivities to, get that gut cleaned up, build the probiotics up. We see so many people go into full remission of autoimmune. So very important to consider leaky gut for autoimmune, excessive mucus in the airway, throat, and ears, and then intense food cravings and tendencies to binge are
Hmm.
some key symptoms of leaky gut syndrome.
All right, so we're going to jump into part 2. So this is an introduction to gut bacteria and dysbiosis. Okay, so let's talk about your gut bacteria. So you are actually more microbes than you are the rest of the cells in your body. So most of these gut bacteria reside in the large intestines. Some estimate that you have about 10 times the microbial cells than your own cells in all your body. So they are constantly evolving and adapting to your environment and lifestyle. So these microbes are mostly bacteria, but there's also some fungi and viruses. And so it's a constant balance, to find that your good bacteria or basically policing, because there's no way to eliminate, and you don't want to eliminate all the other items that are in your intestines. I mean, there should be a certain portion of, small viruses and something that's constantly keeping your immune system adapting and changing. And so we do need that little bit of stress. And so there is going to be those minimal amounts. It's just when those become larger than the amounts of the good bacteria that are in your intestines. And so that's when we get into having, like you said, these bacterial infections take over or these fungal infections take over. And that's what we want to make sure. And that's the whole purpose of us doing this gut reset program and sharing with you guys so that we can get that balance put back in to our gut. So scientists are still trying to fully understand the roles of these microbes and what influence them. But we see that in clinically when we're working with patients. So interesting, like we were just talking about, these major stressors and things that are going on in the life, where you do like a food record with a patient and you see like, oh goodness, like you're basically eating no fiber. And so, we're able to examine this in a clinical way and see like, oh goodness, this is really what's going on with people in this 21st century. Like, there's a lot of people that just don't understand the wrong foods are put in their body and then the lack of the right foods in their body and why their body's going haywire and, giving them the symptoms that they have. So your gut bacteria affects your brain, your mental health, and your stress response. So if you look at this diagram, it basically takes what we talked about a minute ago with these tight junctions in the mucosal layer throughout your digestive tract, looking at the different microbes and food particles and the guys hanging out in your gut, and they should pass through. Again, those things are there. That's normal. It's just when we have a breakdown in the gut. But you can see here the correlation between the breakdown in the gut and how it's affecting our brain. So you can see the different, based on the response from these different pathogens in the gut, how you're getting an immune response. So you see like the cytokines, the different molecules, how that has a direct nerve innervation straight into the brain. And so, we were talking earlier about, brain on fire and how we're seeing that so much more with our patient base. But we're seeing this because the 85,000 chemicals that we're coming in contact with each week, and there's more and more getting named every day, but those are coming in with foods. They're coming in with, different things that we're putting in our body. And unknowingly, if you're not reading the ingredients that you're putting on your plate, or putting on your spoon and putting in your mouth, you don't realize the what the body is trying to respond. And so you're wondering why I have a lack of energy, or, I can't think today, or just don't have the energy or motivation to do anything. this isn't like, where's this coming from? It's coming from the foods that we're putting in our body. So our body is giving us a response. We just have to realize, it's a symptom, and the body is calling out for us to do something about it. So your gut bacteria's critical roles. So two-part: immune system strengths and balance. So 80% of your immune system is in the gut. That's phenomenal, like the way that our bodies are built. So, I mean, you look at this image here, and it's so intricate, all the things that are working together. God put all these things together, and it's so amazing. It works beautifully when we're taking care of our bodies, when we're eating the right foods, when we're refraining from stress, when we're going outside and grounding, and being in the sunlight, and doing all the things that God put, for us to do, and being a good steward of our body. And then the other part, the protection against pathogens. So, our gut bacteria have such a big job, and especially here in the time and day we are in right now, with so much more turmoil in our food system, and and emotionally, what we're seeing, just different challenges in our environment. Our gut bacteria have such critical work to do to protect our systems, and to keep that homeostasis, to keep that health in our system. So what do your gut flora look like? So these are some very interesting images. If we just break this down really quickly, this is an image that we found from nature.com. So, it's interesting if we look at the longitudinal organization, some of the things in that column, like, here's a little section of food particles, and then, what a biofilm looks like. And so when we have different stealth bacteria organisms in the body that have biofilm around them, what does that look like? And that's why, with the gut reset program, like how we've carefully put it together, even using the product like Gut Rescue that can go in and try to peel back that biofilm. It's a very tricky thing to work on. And we've worked with patients for many years to be able to put programs together that to work with some of these stealth infections. But a product like Gut Rescue that we developed is very specific to get in there and work on that biofilm, so that we can strip some of these different viruses and bacteria that are very hard to work on, but get them out of the gut, or take them down a notch out of the gut. You're not going to completely eliminate them, but you can see by just some of the structures what that structure looks like, and how you can see how it's tricky for us to get in there and reduce the amount of these organisms with the biofilm. So see, this is just a little section of the digestive tract. And so when you have all these things going on, you can see how there's impediment in the flow, because these things are very inflammatory. And so you can see just some of the shapes and the sizes of some of these things, what the body is having to work on to, to get a good flow, to move these things through the gut in a timely manner, so we're not having problems. Some even like the fermentation of the gut, because it's slowed down, it allows these characters to get out of control. So very interesting to see, what this looks like, and see a picture of it. So what is dysbiosis? Let's break down the word. So dysbiosis is just too many bad bacteria, or an insufficient diversity and number of good ones. So it's either, you got a whole lot of bad guys, or you just don't have the different types and the number of good bacteria. So it goes hand in hand with leaky gut and poor health, but it's not necessarily the same thing. They just share many of the same symptoms. And so when you're looking at all the information out there, sometimes people will use them interchangeably, but they are different as far as when we're talking about dysbiosis, and then the leaky gut is actually like a breakdown in the gut wall.
Yeah, the way that I like to teach it is just to break the word down. So dys, and then you have biosis, is a disruption of the biology of the gut.
Mm-hmm.
And so that biology of the gut has everything to do with the bacteria and microorganism population. And so we get a disruption in the healthy population, and the good guys population, they go down, and then the bad guys population goes up, and so we get this disruption, which creates inflammation and leads to leaky gut syndrome. But you can have dysbiosis without leaky gut, but you can't have leaky gut without dysbiosis.
Yeah.
So that's a good way to understand that.
Yeah. Thanks for sharing that. So what causes dysbiosis? So a number of things. So usually an unhealthy diet that's low in fiber and polyphenols and high in bad fats. That's the poor fats. So that's like, the trans fats, rancid fats, just poor quality fats, and then sugar. So again, sugar, anti-nutrient, feeds the different pathogens in the gut. So definitely see where that can transpire into dysbiosis. And then you have stress. So we talked about, major life stressors, but just the day-to-day stress. Some people, they're in a poor job, work environment, maybe their family home life, they're just undergoing a season that's, particularly stressful. So, there's not just the major life stressors, but, there's the day-to-day stress. And so, that can come from just emotional stress. There's hormone changes where, women or men go through, and, it's a perceived stress. And so either way, the body is producing cortisol in response, to the stress that it's perceiving or that it's literally going through, and what that can do, compounded by having too much cortisol circulating. Different medications. So we see that as a stressor, especially antibiotics, and what that does to the gut. Sleep deprivation. So a lot of people, this whole sleep rhythm, the body just gets confused. We have people that work night, graveyard shifts. And so their body's a little confused because half the month they're, working this shift, and then the other half they're working this, or, some different sleep patterns. And so how that really causes a toll on the body. The body does so much restoration as we're sleeping at night. And so it's just so important for us to get, this really good, at least 6 to 8 hours of quality sleep. And so we see how people who are having sleep issues, how this corresponds to their dysbiosis. And then inflammation in the body and the gut. And so this can, again, come from medications. This can come from just other health issues that they're dealing with. And how we see that, how it corresponds with dysbiosis. Gut infection. So again, that's, too many bacteria population, or a parasite infection. So there's all different types of gut infections. And then an unhealthy nervous system. So people that have never been adjusted by a chiropractor. And so we know what stress does on the body. So everything from heavy exercise, heavy lifting at work, a repetitive motion, sitting too much, tech neck. So this can, this not having a healthy nervous system, how, your body then has a communication issue between the brain and every cell, tissue, organ, and gland in the body. This nervous system is so important. So we're big advocates of chiropractic, and how that can really correspond to getting your gut rebalanced. All right.
All right. So this takes us to part 3, the gut reset. An evidence-based health building self-care program. And so that's what this program is. It's science-based. Number 1, it is designed to heal the gut lining. Number 2, rebalance the gut flora. And then number 3, help you find your personal healthy and unhealthy foods. Mm-hmm. And that is so important because what we see is some people can actually tolerate certain foods. And I'm talking about healthy whole foods, and other people can't. Mm-hmm. And so we're going to learn a lot about how just the nature of different foods can actually cause this inflammatory response. Mm-hmm. And so the gut reset framework, step 1 is we want to remove the root causes. So that's removing gut irritants. And so that's going to lead us into the gut reset diet. And then we will actually reintroduce these foods later. And that's going to be where we get to be diagnostic and see, okay, when I reintroduce, let's say, wheat to my body, I get a headache, or my shoulder hurts, or I get stomach pain, or I have anxiety. So we can tell now, okay, that is a gut irritant and that is not good for my body at this point in time. And that might not ever be a food that you reintroduce again. And then we want to remove or minimize stressors and introduce stress management practices so we can get control of stress hormones so that we can help our gut heal, help our body get a better inflammatory response. And your body needs to be in rest and digest mode in order to heal your gut. And
Mhm.
number two, we want to support gut healing. So that's done by prioritizing sleep and supplements like Gut Revive. This is a very special form of glutamine, really has a nice anabolic effect on the gut mucosal tissue. And then probiotics like Gut Restore, where we're getting 18 different strains of probiotics. We're getting a sporing probiotic, so we can actually get in there and just plant and re-inoculate, get a nice diverse population growing and growing quickly. And then step three is weed and reseed. So again, spore-based probiotics, lactic acid probiotics, and botanicals to inhibit the growth and break down biofilms, as Dr. Katie was teaching on earlier of bacteria, yeast, and parasites. These biofilms really make it hard for the body to get rid of this stuff. But when you have the right botanicals, we can actually dissolve these biofilms, get that stuff off of the gut lining, get it out of the body. And step four is when we reintroduce food, so we can now see, hey, is this food good for me? Does it cause inflammation? Does it need to be a part of my lifestyle?
Yeah.
And then root cause number one is inflammatory food reactions. So I have a very personal experience with this. It wasn't until I met a mentor of mine who actually diagnosed me with a gluten problem. And so we learned about gluten in school, but it wasn't until I went to a holistic practitioner actually diagnosed me with that. And so many of my chronic problems went away after some of them just a week or so of getting off of gluten, and then so many more after being completely gluten free for a couple months. And so basically, with food allergies, you're going to have an immediate or severe allergic reaction. We call that IgE mediated. So the way I teach that is the E stands for emergency. And so most of us know when we have an IgE mediated, you're going to get the swollen lip, maybe your throat swells, have to go to the hospital. That's the peanut allergy, or maybe like the severe sensitivity to a wasp sting. So that can be tested in the blood or with skin test. Again, they're usually life-threatening and they resolve within a few hours of eating the food. And then we have the ones that have really flown under the radar for many years, and that's the food intolerances. And that's really from an inability or lack of enzymes to break the food down or that substance down. And so we get histamine or amine intolerance, lactose intolerance. That's a real widely known one. And we had FODMAP intolerance as well. So we can often manage these with supplements and enzymes to help break the foods down, but some of these we can't. And so we'll learn which foods we can have in our diet. Some of them we can have once a week, maybe once a month, and others we just have to stay away unless we want to pay the price for the symptoms.
Yeah.
But for many of us, when we see how bad the symptoms are, we don't put it back into the diet.
Not
And
worth it.
then, yeah, not worth it at all. Number three is food sensitivities that actually create inflammatory reactions. And these can actually be delayed up to 7 days after eating the food. And so that's where we got to really do our detective work, because you could eat this food on Monday and have a headache on Wednesday, or you could eat the food on Monday and you're very irritated on Tuesday and you're tired, but you didn't realize it was what you ate for lunch. And so this program is designed to help you discover and detect which foods your body can handle and which ones you need to get out. Because when we get these foods out of the body, now your body's not having to manage and use very valuable resources to go after and create inflammation. Now we can use those resources for optimization of hormones and organ function and neurotransmitter balance, and we can start to feel good again. So it's very important that we find this out. Many people find that they can tolerate small amounts of it, but of these intolerances and sensitivities. But again, it's going to be very specific to each person's immune system and body.
Yeah. And just to add on to what Dr. Eric was saying, so make sure that you're downloading and using the weekly symptom tracker and also the daily food journal, because again, some of these foods, it's a very investigative process. I mean, you can spend the $1,500 on a very high end food sensitivity panel, or we can go through this process where we're tracking the foods that we're eating daily. And for the most part, if you miss something here or there, but you're going to catch it next time you eat it. If you're writing down the foods on a daily basis, and it may be at the end of the day when you have a minute, but jot them down. Because again, we got to find out if there is a certain food that is just, wreaking havoc in your gut. And it's, you eat it and then a couple days later or even the next day you're having these symptoms. We can pinpoint if we're looking at our weekly symptom tracker or we're looking at this daily food journal. It's just for 30 days. So, buckle down for 30 days, do this so we can figure out what foods are causing problems, eliminate them. And then we'll talk about how we're reintroducing foods and doing this in a fashion where, if we add them in different steps, we can, in different order, we can figure out what that one food is. And maybe you'll pull it out forever. Maybe it's 4 or 6 months until we get the gut really healed. But it's amazing when you can find that one food, pull it out, and it's a game changer.
Yeah,
So
we've seen things from chronic seizures just completely go into remission, autoimmune go into remission, fibromyalgia go into remission. One of my like profound symptoms that cleared was just a lifelong of anxiety. You learn to manage low level anxiety, but it's always there. And then when I completely got off the gluten, learn what had gluten in it, the different wheat products, what to eat at restaurants and what not to eat, I started to see that anxiety completely disappear. So this can be a profound game changer for your health.
yeah, yeah. And just to add on to that, me being married to Dr. Eric for a number of years, like I've seen that process for him as, he had stopped eating gluten before we met, but it still took years. So no, like your body's physiology is going to change for the better once you identify that food and pull it out. And again, some of them might be forever, like, his testing and finding out that he actually had celiac disease made it where he would never put wheat back in his body. However, it did take a good amount of time for that inflammation to slowly work out of his body. And, after that point, once, he got most of the inflammation out, the anxiety went away. So just an amazing game changer for him. And just seeing as a family member, I mean, this is really connected to you in more ways than yourself, like what you're dealing with. And I know you guys are watching this video and listening and going, yeah, I mean, that's me. I've dealt with chronic anxiety, and you see how it affects your relationships with, your family members and your friends. And maybe you don't want to go out and hang out with friends because you deal with anxiety and don't know how to like handle it. And maybe it's just a food. And so if we can pull that out and help you get your gut, rebalanced, and that way you can get out there and enjoy life again. I mean, that's what this program's all about.
Yeah, it's very, very important. All right, so gut irritants. So these are things that actually can cause your gut to leak. And so plants actually produce gut irritating substances that are really a shield and defense from predators. And depending on how we actually prepare our foods, we can't get rid of these irritants. And so they're found in many of the plants that we eat. And they're found in their reproductive organs like the seeds and the fruits. So some of these, which gets tricky, they're actually health foods like legumes and tomatoes, but they can cause leaky gut for some people. And I've had several vegans come in, and they were on the Standard American diet. They went vegan and had a period of time where they really felt quite a bit better. But then they started noticing more inflammatory symptoms. As we went into their diet, we saw, hey, they were actually getting a lot of these gut irritant whole foods. And because they're eating more of those, because they weren't getting the animal proteins, they got more inflamed. So it's very important to understand the science of how foods are made.
Yeah. So we're going to break these down a little further, these gut irritants, so you can understand why they're causing so much havoc.
Yeah, so we have lectins. Lectins have the same Latin root as the word select. So they can help cells actually recognize each other correctly. They are proteins that recognize and bind to a specific chains of sugar molecules outside the cell surfaces. And sometimes plant lectins actually recognize sugar chains on our cells, especially on the surface of our gut lining and immune cells. And that's where they can cause potential damage. They're very difficult to digest. They're immunogenic, which means actually stimulate the immune system. And some people have antibodies to very specific dietary lectins, like gluten, in my case. So food sources are all seeds, including legumes, grains, nuts, and nightshades. Known toxic lectins include castor seed ricin, kidney beans, agglutinin, and wheat germ agglutinin. And gluten and bacterial insecticidal toxins are actually lectins as well. And that's been was the big problem with me, was actually my severe sensitivity to a lectin called gluten. And so when I got that out of my system, the standard American diet, even eating a whole food diet, still is considered by some authorities to have grains in them. And so you think you're being good or doing the right thing, and you don't realize, hey, even this whole food could be causing severe inflammation in my body. So it's very important to understand lectins and these different food irritants that we can have in our diet.
Hmm.
All right, so we have glycoalkaloids and saponins. These are substances that are similar structures to cholesterol. They actually have a soap-like property. So soaps disrupt fats. That's why you put soap on greasy dishes. Actually helps to emulsify that and break that down so that you can absorb this stuff. But these saponins can actually rearrange cholesterol in your gut cell membranes, creating pores, and can actually harm the cells. And so where we see these main sources are the nightshade plants, especially raw ones, and quinoa. And I've seen this a lot over the years. You'll read about a culture, and maybe they are known to be a healthy culture, like the Chinese or some of the different Asian communities. And so we'll actually look at their diets and borrow, particular food from their diet, like we did with soy. And we've seen if you don't prepare soy right, it can actually cause problems in the body, from actually cause inflammation to even increase estrogen in your body, which isn't so good for everybody. And then we've actually seen that with quinoa. Quinoa, it has a lot of nutrition. And, when you break down soybeans, there's a lot of nutrition in there, but it can be very hard to digest. The same thing with quinoa. When you really do your research, you see that these cultures that ate quinoa, they might have soaked the quinoa for 2 weeks. And what we find is through different soaking practices, even dehydration with some foods, actually break down these lectins and glycoalkaloids and saponins. And so we don't get all that, exposure when we eat it. And so when we're looking at foods like quinoa, they have to be prepared a certain way so we don't create that leaky gut cascade.
Right. Yeah. And we're fans of Weston Price. We've studied their information for a number of years. Also, Dr. Gundry has some really good, he wrote the Plant Paradox, but he has some really good information on preparation of food. So again, like he was saying, these foods have really great qualities, but it's how they're prepared. And so if they go through a fermentation process or a soaking process or a sprouting process, a lot of times you can eliminate some of these, gut irritants, which are like the lectins, and what we're talking about right now, these different ones, so that you can put them back into your diet. So again, some resources if you want to look into those, so that you can see, how to properly prepare some of these foods as you introduce them later. In the Gut Reset program, we eliminate a lot of these out because our main focus is getting the gut, repaired and work to get that gut integrity back. And then as we're reintroducing foods, we just want to make sure we reintroduce them in the right frame and in the correct way to eat these foods. They're prepared correctly.
And we also have phytates, a very common irritant to the gut. And phytates are actually anti-nutrient, which means they bind to the nutrients and just pull them out of your body, especially the unsoaked, unsprouted grains and beans. And so they bind to them and then they just go out the body. So you have to watch that with certain fibers. And this is real interesting, just within our family. Our son, he's never had a drug in his body. He's really eating a really clean diet. But we had a period of time where we were busy, and so we had somebody helping us, to look after him during the day. And we noticed he got one of his first cavities. And so we were just really perplexed because he takes supplements, he eats so well, he doesn't do hardly any sugar at all. And he is a very, very healthy kid. He's actually never been very sick at all. He adapts really quick when he gets exposed to different viruses and so forth. But he had his first cavity. And so we were scratching our head. And what we realized as we went back in and did detective work, okay, what has he been eating? We learned that he actually had been getting a lot of bread and grains. And so once we took those back out, which wasn't something he really had a lot of, but in that season he did.
And to make note, these were gluten-free grains.
Yeah,
so
gluten-free
his
grains.
grandma follows a gluten-free diet to a T. And so he wasn't getting just your normal, white bread and, rolls and Subways. I mean, she really put the effort in to make sure if she was serving him cookies or a bread that it was gluten-free. So just to add that little note in there. But
yeah, and so this is the power that phytates, to take the minerals out that actually mineralize the teeth. And so we definitely have to understand the role of phytates and all these other different foods.
yeah.
And then we have protease inhibitors. So plants prefer that animals defecate whole seeds, so that helps to actually spread and propagate the seeds. And so those seeds are actually coated with a protectant, which is a protease inhibitor. But these can actually irritate the gut, prevent optimal digestion, increases in protease production in the gut, which then chew up the gut lining proteins. Milk is also high in protease inhibitors, and many bitter substances such as the saponins and tannins and actually inhibit proteases. So it's another thing we need to consider when we're looking at our diet for different irritants, so we can heal from leaky gut. And then we have partially digested proteins and molecular mimicry. Some real fancy words there, but food molecular mimicry is when a partially digested fragment of your food are very sufficiently similar to tissues that when an immune system develops antibodies against them, and then those antibodies can also recognize your tissues. And so this is where we start seeing this autoimmune effect actually being created from different foods that we put in our body. So we really need to understand the science behind this so that we can recover from autoimmune disease, cover from chronic fatigue, and so we can prevent ourselves going down some of these roads that these foods can actually cause. Then we have egg proteins. Ovalbumin is a protein in egg whites, can actually trigger allergic reactions, according to allergy research. I will say though, before I go on, I consider eggs a superfood. The protein's great, it's good fats, good vitamins in the yolk. So we like the cage-free eggs, free-range eggs. They're very good for you. But in some cases, we have to consider that, especially if somebody has leaky gut and somebody has a sensitivity to the egg protein, that we can be creating a problem and an allergy problem, because it can be a very potent mast cell stimulator and create lots of histamine in the body. But many egg proteins can cause allergies and sensitivities. So we have found people do have relief when they remove eggs from their diet, but it is very, patient specific. I wouldn't put that across the board. Again, I've been going since 2005 with functional nutrition and chiropractic. It's not something that I've seen be a major problem, but I have seen it be a player for different people with their food sensitivities, and then causing the histamine and the gut issues as well.
Yeah, so we have built that into the gut reset program. We have removed eggs. We found a fabulous replacer for people that need to, of course, in the 30 days, pull the eggs out. So whether you have an issue with eggs or you're unsure if you have an issue with eggs, this will help us know and determine. So when you reintroduce them in, you will know at that point. But there's an egg replacer called Just Egg. And so in the recipes and the recipe guide, you will see that, and you should be able to find that in your local grocery store.
And then we also have biogenic amines. Biogenic amines are bacteria-created products of amino acids, and they include histamine, tyramine, putrescine, tryptamine, and cadaverine. Large amounts of these amines are also present in spoiled foods, seafood that is not fresh, smoked and cured meats. And so they can actually cause food poisoning, allergic symptoms, and one of the big things they cause is excess histamine and really inflame the gut lining. So we have to really consider these what I call histaminic type foods, because histamine can be very, very irritating to the gut and to the brain as well.
I'll just make a plug real fast. So one of our friends owns a company called Vital Choice. They specialize in sustainable seafood and having, seafood that is caught in the right areas. So they have like a smoked salmon. They have just different types of meat, but it's, the preservatives are not there. The junk's not there. It's fresh frozen. And their stuff's amazing. So we've ordered, halibut and cod and different types of salmon.
Yeah,
There's
salmons.
a large array of salmon, but their stuff is very high quality. So again, once you're reintroducing some of these foods into your diet, make sure that you're buying good quality. The health of your body is parallel to the health of the foods that you're putting in your body. So I know that kind of sounds funny. It's a paradigm shift, but your thinking should be, I want to buy the best quality eggs. I want to buy the best quality meat. I want to buy the best quality organic produce, or grow, these things if, you have the land and the means to do it, so that you're putting the best into your body to reduce your exposure to the things that we've been talking about this whole time. So if you know where your food's coming from, if you're preparing it properly, once you get past, this season where you're getting your gut reestablished, moving forward, put the right foods in your body. It's worth it. There's nothing that tastes as good as feeling bad. And I say that to people all the time because I've been there before. I've been in a state where I couldn't get out of the bed because my body was so weak and I was exhausted, and I was very stressed out, and went through a season where I wasn't eating the right foods. And so I've been there before, so I can tell you it's so worth putting the right foods into your body.
Yeah, it is so important putting the right foods, and you just see that, and we've seen it over the years. The patients come in, and probably the hardest thing to get them to switch is changing their eating habits. For the patients that come in and understand the program, the approach, uh, just trust us that the foods are such a big part of it, and then they actually change the way they're eating. You see them be so successful, and most of these people, they've been sick for so long. Now that they can actually feel good again, they don't want to go back. They just don't want to go back, and then their taste perception changes. And so many of them tell me, like, I was off of the Dr. Pepper, for 3 months, and we were so excited and celebrating that. And then so they decided to get a little sip of it, at work, and they said it was just not the same anymore. They said it tasted so sweet, so fake. And so just give your body some time, as we get away from the bad foods, introduce good foods. It's just so important, and it'll be so worth it for you.
Mm-hmm.
This next slide here, though, we're talking about alcohol and food additives. So these are major gut irritants. This is one thing you really have to understand that can really make you make a different decision about eating so much fast food. Is a lot of the flavor in the fast food are from food additives and colorings and flavorings, and they're chemicalized.
Artificial.
Yeah, artificial, and they make a big impact on the gut. And so you can actually just eat the fast food over and over again, get the bad oils, get all these additives, the sugar, most people are doing soda pop there, and you're just wrecking your gut. You can eat your way into that leaky gut, cause a lot of trouble. But these are major irritants, gut barrier disruptors. So we want to avoid that on the gut reset. And some of these additives, they act like surfactants that help to give the food, a different texture, but they interrupt the gut barrier as well. So we want to identify those in our food, and we want to mostly cook at home from scratch, so your foods won't have labels. When you have to read a very long label and look up a chemistry word to understand what's in your food, you probably shouldn't be in that. That definitely shouldn't be a part of the gut reset. But you can refer to the food additives label, read that label so you can identify these harmful ingredients.
Yeah.
So other plants in this slide, we talk about the different defense systems that they have and the way it creates intolerances. And so we have something called oxalates, which are anti-nutrients, and those can be found in vegetables. Oxalates can also lead to kidney stones, vulva pain. This can irritate the gut and cause fatigue. Then we have salicylate, sulfites can cause allergic reactions. Found in a lot of processed things like fruits, coconut products, different processed berries. You even have to watch out for some of these things, and processed alcohols like red wines, even white wines. Then we got benzoates like sodium benzoate. They can be found in nature, it can be found in cinnamon. Just something to know because you can actually have an allergy to that. And I have seen that show up quite a bit on food sensitivity panels. So in our clinic, we find that most people, even with autoimmunity, do fine with a lot of green vegetables and fruits. And so we do include these foods in the gut reset. However, if you know for sure that you're going to have a reaction to them, then you need to eliminate them from your diet.
Yeah. And a lot of people, they know those foods. And so, this program is about you further investigating and learning and letting us educate you. But those foods. And so if we, it's whether they're on the list of okay foods, because it's like we said, even a healthier food, the body can have, built an intolerance to it. But if it's a food and it's on our okay list, take it out. We want to make sure that this, is customized to you. But definitely if it's on the list to avoid, take them out, because we really want to make this a process where you can learn, and get your health back by getting your gut healed. So I want to talk about the gut reset food list. So we were just talking about, acceptable foods, foods to exclude. So I just want to run through these real quick. You have these resources, you have a shopping guide. So it includes all this on a very precise basis. It goes into a lot more detail, but on the okay list is fresh and healthy, high quality proteins and organ meats. So wild caught fish and shellfish. Again, if you're not allergic to a shellfish. Hemp protein, vegetables. So most of the vegetables are on this list, and they're broken down even into the percentage of carbohydrates. So people that are maybe following a more ketogenic diet have this broke down for them in the shopping list. Root vegetables and fruits, reasonable amounts of nuts and seeds, and again, ideally soaked and prepared correctly. So either soaked or sprouted, if that's possible, or you can buy them. There's a lot of companies now that are, having foods available that are prepared correctly. So if you're just a, person that's in high speed and you have a lot going on, that's okay. So, just spend that money buying the food prepared correctly. Or you might have a local person who's willing to do that. So you can find them through your local farmer's market, and they love doing it. So, pay them to do it and delegate. High quality fats, so coconut, avocado, ghee, olive oil. So ghee, again, this is taken dairy out, but ghee is the only acceptable dairy item because the dairy proteins have been pulled out. So you can basically see through ghee if it's prepared correctly, and that's why it's acceptable. But olive oil, which is, in a low heat application, and then grass-fed animal fats, and then meat, bones. So if you're making bone broth, which is super nourishing and healing for the gut, mushrooms, and then onion broths. And then in the exclude list, and again, the shopping list goes into detail, and then there's an avoid food list that goes into detail, but grains and legumes, we're taking those out. Those are sources of what we, went over with these gut irritants, lectins, protease inhibitors, and phytates. Dairy, so all dairy except for ghee. Soybeans and soy products, sugar or sugar substitutes. So we did allow for stevia, monk fruit, and then erythritol or xylitol. So even those, if you don't have to have the sugar included, and that there was a few recipes that I did include the stevia and the swerve in, but again, it's very minimal amounts because in too much, we can cause a little bit of gut irritation. caffeinated beverages, because caffeine is extremely harsh on the gut, especially when we already have a little bit of stress there and we're trying to get it healed. But that includes coffee, tea, soda, and energy drinks. Smoked and cured meats, especially if they're not done correctly. But again, Vital Choice is that resource I gave you for having better quality smoked and cured meats. So also vegetable oils and hydrogenated or processed fats. So we really want to focus on the right types of fats. And so that's going to be ghee, olive oil, avocado oil. Those are the main three go-to oils because they're healthy for the gut. And then we want to eliminate fried foods. I know that's hard. So many people have an addiction to, certain fried foods, but I have included in the recipe guide some yummies that I think you'd be totally fine with eliminating fried foods. I put some baked fried artichoke hearts in there. So make sure you get that recipe guide and download it and get your goodies at the grocery store to make that. And then eggs. So we did have an egg substitute. It's called Just Egg. And it's actually made from mung bean sprouts and some other healthy options. So it's not your typical fake egg substitute made with poor quality items. And so you'll be able to enjoy that in some of the recipes because there are some baked goods in our recipe guide. All right, so other ways to support your body during the gut reset. So we want to make sure that we go over these few additional items. We want to prioritize sleep. So make sure in this program, it's okay to rest. It's a 30-day program, and we want, as we're healing the gut, it's vital that we're getting rest. So if you need to take a nap and you have the means to do that in the afternoon, do that. But by all means, make sure that you're asleep by 10, 11 o'clock and get that full 6-8 hours of sleep. We do have a product. It's not included with the Gut Reset program. It's called Magnesium Power. Amazing supplement, super helpful for getting to rest. So it's basically, it comes from coral reef, and it's a great ionized natural form that your body can absorb. Coral magnesium blend, and it also has some of the medicinal mushrooms included. And so this we've used for years and years. Amazing. We have patients, we've taken it off their nutrition schedule and they demand to have it on there. So if that product seems helpful to you, make sure you grab that on our online store and get that into your hands so that we can get you resting during this 30-day gut reset. Also managing your stress. So whatever you need to do, talk to your family, talk to your friends, your support people around you, and let them know, hey, I need low stress. I'm trying to, work through this program and get an A+ on it. And so you really need to find any loopholes and areas where you're dealing with stress and try to minimize that at all possible. And also to support detoxification and elimination of the body. So make sure we're drinking plenty of purified water. Reverse osmosis is best, but just get the best water that you can. So if it's a spring water, if it's a reverse osmosis that you can have the means to put that in at some point in your house, it really does save money in the end because you're not, making these trips and going to the grocery store. You're putting your water in your glass jars at home and drinking it that way. Eat a lot of vegetables because they're full of detox supporting fibers and vitamins. We do have 2 products, Green Power and Red Beet Power, and they are amazing powerhouses of nutrition. They are both fermented. The greens is a blend of greens that have been fermented in capsule form, and the Red Beet Power is a fermented red beet root. That's all that's in the container. Both of them are amazing. They're energizing. And if you've not tried them yet, check out drericksnow.com and our products. And you may want to give one of those a try. And you can wait till after the Gut Reset program. But again, amazing, great nutritional insurance. And then make sure that you're participating in some gentle exercise and movement throughout the day. So important that if we're sitting at the computer long hours, we're getting up and stretching every 10 minutes. If we're indoors for a lot of the day and not able to really move around, make sure when we get off work, we take that extra 30 minutes every day and do something that's moving your body. It's super important. And then what to keep in mind. So, a couple of things as we're going through these gut reset program. Make sure sometimes your symptoms get worse before they get better. That's okay. You know, we've seen that before. It's okay. I don't want anyone to, you know, get nervous or stressed out. A lot of times this is due to a die-off reaction because you're changing your microbiome. Again, the products that support this, the gut rescue, it's eliminating some of these biofilms. And so you'll get a little bit of fungal die-off, you know, even, you know, different viruses and bacteria, some of these stealth bacteria. When you're breaking them down, they're eliminated throughout the body, you might have a little diarrhea, and that's okay. You might have a little nausea, that's okay. But definitely know that this is a possibility. So you may have withdrawals from the previous foods you were eating. So the more inflammatory foods before you started this gut reset program, and that's okay. You know, things that we know for sure that have helped us, you know, deep breathing exercises, using lavender and different essential oils that are relaxing and calming. There's a kava liquid from Herb Farm that we use often. And so when we fast, sometimes we do a little bit longer period of fasting. And so you're like, oh, craving some food. Make sure that you do a couple drops of the kava and it'll take some of that food anxiety away. And also withdrawals from stimulants. So a lot of people, they've been on caffeine, they've been on alcohol, they've been on different herbs. And so when you're taking some of these things out, when you're doing a program like the gut reset program, there can be a little bit of a withdrawal period, but that's okay. Just know and expect it so that you know and you're not stressed out about what's going on. Again, support your body and give yourself grace during the gut reset. So avoiding a strenuous exercise until you get about a week under your belt. And, you know, if you're a normal exerciser and your body's already adapted to it, that's one thing, but don't start a strenuous exercise program in the middle of this 30 days if that's not what you were doing before. Too much stress on the body. Minimize any mental and emotional stressors as much as possible. If there's a person in your life and they just cause chaos, take a break from them for 30 days. I think that's okay. It's fair because if you're in better health, then you can have better relationships. And maybe that's something you can work on after the 30 days. Make sure that you're prioritizing rest and sleep. Again, this is high up on the list, making sure that we are putting rest as a part of getting our guts healed. All right, so to wrap up, you've learned the science behind leaky gut and dysbiosis. We've talked extensively about this in this video and how to repair them. And make sure you check out our next video where we'll be discussing food journaling and how you can use it to understand how foods may be contributing to your symptoms. I'm Dr. Katie Snow.
I'm Dr. Eric Snow.
Helping you to transform your health naturally.